For many years, I was part of a profession notorious for breaking bodies down. It led me to Find Foundation training, where I fixed my own injuries and began teaching others how they can do the same. I've decided to go on the road, to gather stories of resilience and overcoming the odds, reminding us all that we're on a road to wellness. San Diego, just got finished doing all of our notes at the coffee shop. We are headed to Dr. Dana Barret's house. We're gonna meet up with Riley Morgan. This is my buddy Riley Morgan. We're gonna do a little chat with him about his injury at Pipeline this last year.
Basically, I spun on the biggest wave I could see in a set and just didn't paddle hard enough and went over the falls in like an 8-footer and landed before the lip, and then the lip shot me straight down like in a seated position and compression fractured L2 through 5. For like the first 3 weeks, I basically struggled to get out of bed. Gradually with like foundation and others, like seeing Dana.
Riley, when he was in his acute stage, it's probably a lot of pain. So your body's in a sympathetic state, like a basically anxious state. So to calm that down, we utilize breathing. It's the most important, and meditation. Motion of the diaphragm is going to help decompress. Switch your brain over to a parasympathetic state and recalm the body, and then allow blood flow to the injured area. Healing can then occur.
I gained more and more mobility every time I did it, and then it's just been better and better progressively through like my whole time recovering.
All right, guys, we're gonna fill Dr. Barret's script here. Breathe and expand, slow and controlled into the nose. The back of the rib cage goes wide. As you exhale now, you're engaging, drawing the abdominal away from the fingertips. One more. What is this bad boy here? What's the why here?
This is to kick people out of my office so I can go surfing.
All right, you guys, I got my coffee. Trying not to spill it. Let's go over to Dr. Lee's office and see what cool stuff we can learn.
Born and raised in New York City in Chinatown. Thought my role was supposed to be in finance. And I worked on Wall Street for 10 years. And then I had no idea. I decided, I really love my acupuncturist and I really love how she's helped people. So I decided to take the leap and go back to grad school. And so I got my master's and also my doctorate in Chinese medicine.
Random question.
Okay.
What would you tell a patient that drinks as much coffee as I do?
We're creating this upper level, extra energy, right? And I'm trying to okay, calm down, Jesse. This is what the spasm did to the needles.
No, that was me harnessing my machismo.
Plus a little bit of, dehydration.
Oh yeah.
From caffeine, so.
I had to ask you guys.
With Chinese medicine, it works more at the root and from internal to external through meridians and channels. So it's qualitative, but also methodical. And then where you show me where you have pain, I also focus on that, what you're coming in for. Is similar to foundation training, where the hips and the pelvic area, that's foundation for us too.
I've heard time and again that Western medicine really addresses the symptoms. I mean, amazing when you need a surgery, when you gotta go to the ER and a limb's falling off. They go to the symptom and they want to treat it and give you a pill, give you a med. And like mine, attention deficit disorder, they would just take this med. Not let's get to the bottom of why that's happening.
I'm all about using all different kind of tools. The biggest thing I find in everybody is nobody's breathing, and it's closing in on their breath. When we were doing treatment, I put in the needles and then I have patients breathe.
I felt completely reset when I left, like a degree of stress and tension that I didn't even realize I was carrying had been lifted off. Thanks for giving us a couple minutes.
Thank you.
COVID test time. We are round 2. How's it going, man?
I'm great. How are you?
Good. These guys got all the training, man. This is the one. The gentle touch. Connecting with Shelby Stranger to do her Vitamin Joy podcast. What's up, Shelby? Yeah, he needs to see it. So I was like, oh, we might get a wave after this. She dug in, and then all of our time with
Jesse Salas, welcome to Vitamin Joy.
Thank you for having me, Shelby.
Yeah, we met in Nosara, Costa Rica, randomly at a juice bar.
Yeah,
years
doing
ago.
ginger shots.
Can you just tell me a little bit about foundation training and just quickly what it is?
In a nutshell, we use it with people in acute pain symptoms, primarily back, but we also use it with athletes and people that are just wanting to move and perform better. The body starts to adapt those postures, and next thing you know, muscles are out of their effective length, and you start to build these compensations. We need to be balancing out the way our body is absorbing and dispersing force.
I mean, they're not fun. They're a little tedious. It's not like going out and going for a run or going for a surf. But I have noticed that if I do them, I can go surf or I can go for a run. And when I don't do them, I tend to get dumb injuries. What are a couple things we can all do to just feel better in our bodies now through a podcast that you can explain
Through a
to me all?
podcast, I would tell you easiest way to understand with learning to do decompression breathing is something you can apply anytime, anywhere. It allows you to sit up tall, anchor your pelvis, which is an isometric contraction, the muscles that attach your femurs to your pelvis. This is very specific to Doc Goodman's theory in his book, True to Form. And then learn how to expand and elevate the rib cage in a 360-degree pattern.
What should listeners do for their Vitamin Joy challenge?
You take an inventory of how much sitting to standing and moving you're getting per day. And try to match for every, we'll say, hour of sitting, at least 5 minutes of moving.
Oh, that was awesome. So I'm hitting stop.
Before.
Yoo-hoo!
But I'm curious what this is. Let's find out. This is a little Christmas gift. See that right there? See that? Caveman coffee. Only the best. This stuff is amazing. The Mammoth Roast, my brother put me onto it. And new tongue scrapers. Loftmel tongue scraper. Really cheap, good hygiene. I hope you all enjoyed today's episode. If you want to try the workout or watch the full interview, click the links. You can find all of our guests in the descriptions below. And don't forget to like, comment, and subscribe.